Hey everyone, my name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist, and in this video I'm going to go over the split standing balance series. The purpose of this series is to improve your core performance as it relates to your balance. So a lot of us are, if I tell one of my patients or clients to balance, they don't really have an intent beyond don't fall. So if we put a little intent behind it, whether that's through breath or more, you get a lot more out of the balance drill and it becomes more of a core exercise. But I want to just say that working on balance is a core exercise, and depending on what you focus on, like let's say if you focus on your feet, it is a core exercise for the core muscles of your foot, as well as everywhere else, but primarily for your foot. So wherever your intent goes, that's where your main training gains usually happen. So we'll start off, and your feet are going to be hip width apart, and my front leg is in a position so that my shin is perpendicular with the floor. And my knee is soft, but not because I'm bending my knee, it's just soft. It's more because of my hip position. Then I go from a flat back foot position where my toes are facing forward, and I lift my foot and engage my calf muscles. So my toes are curled under and I'm active off my back leg. From here, I'm just gonna take a moment and see what I feel. I could feel that my leg muscles and my lower leg in the back, and then my glutes, especially if I squeeze my glutes in the back, are working. And then on the front, if I press my toes, splay my toes down like this in the front, I can feel that more in my feet. And then I can also actively press my knee out to the side like this. So it's more in alignment with the front of my foot. Or I could also engage the glute in the front. And whenever I say engage, I don't want you to grip, just connect. Then in this position, the first thing you'll do is just practice diaphragmatic breathing. And you can do it like box breath, where it's an inhale count for 4, pause for 4, exhale for 4, then pause for 4 once you exhale. Or you could do any other breathing style that you'd like. The goal here is that your back isn't arched, your pelvis is in neutral, and then as you breathe, you're expanding in your chest, your belly, and your ribs. It's not elevating your shoulders. So you could do this 5 to 10 breaths and then switch sides, or you can do it for 1 minute to 2 minutes. That's step 1. The next step would be to add head movements. You can do the head movements with or without the breath sequence. So I would start off, I'd turn my head, and then I'd come back. I could breathe in as I turn my head, and I can exhale as I turn back. And I would do that about 10 times, and then I would switch. You could alternate, but you could get dizzy as well. I would probably do 10 on one side, then 10 on the other. Then I could just close my eyes and practice breathing. And again, I would do 5 to 10 breaths, or 1 minute to 2 minutes, 2-minute breaths. Then I could also close my eyes and turn my head. And I could do that 10 times each way. Or I could fixate my eyes on an object straight in front of me and turn my head while keeping my eyes fixated on the object. That would train your core system a little differently. The other option, so that's level 2. The other option for level 2, it's not necessarily any easier or harder depending on your individual strengths. You could lift one arm forward or up, and it could be just the weight of your arm, or you could have like a band or a light weight here, and you would follow that same sequence. You could either breathe here, or you could turn your head, close your eyes, and then close your eyes and turn your head. So finding something that's challenging enough that you're really studying rather than just coasting through. When you go to lift your arm, be sure that you don't arch your back. You're just lifting your arm. You could do both arms as well. One arm is a little different, especially if you have resistance to it. The next step here would be thoracic rotation. So in this option, what's going to happen is you're going to rotate your upper back without your pelvis opening, without your hips opening. So I'm going to turn my upper back like this, and then I'm going to come back to the center. Turn my upper back, then come to the center. I have my thumbs pointed to my sternum so that I don't cheat. It really helps lock in your ribs and your thoracic spine versus opening through cheating with your arm. If you'd like, you could also, let me show you from the front, looks like this. So my pelvis does not open, it stays forward. If you'd like, you can do it something like this. Arms stay forward and you rotate and your arms open. Eyes follow your hands like this. Show you another view. Starting here, all the while my feet stay active, glutes stay active, opening up, and then coming back. I can inhale and then exhale. Inhale and then exhale, or I could exhale and then inhale. Just trains the deep core a little bit different. I'd also do this on the other side. 5 to 10 reps or 60 seconds to 2 minutes. Then I would do that on the other side, all of those on the other side. Do you have to do all of those exercises? No. If some are super easy, move on to one that is more challenging. The easier ones are good to do as like a warm-up, maybe do 5 reps just to get your body oriented and then progress. Last two bonuses for the last one is you would essentially keep you're gonna start with your head. If I'm here, I'm gonna start with my head turned behind me, and then I'm gonna rotate my head to the opposite direction, still making sure my pelvis does not move. The other bonus is eyes closed, which makes this a heck of a lot harder. I hope this was helpful. Overall, you may not necessarily feel this as you would a plank or a sit-up, but that's okay. You're still training a part of your core that most people neglect because they just don't know all the facets of core training. This is our postural system. This system is how and why we can get crushed out of nowhere but not fall. This is how we can really react quickly in sports. So it's really important to train, and when that piece is missing, you're missing a lot in overall health and overall athletic performance or just exercise performance. If you have any questions, post them below in the comments. If you like this video, please press the like button. If you know anyone that could benefit from this video, share. And don't forget to subscribe so you're notified every time a new video is dropped. Thank you so much for watching.